And thank you very much to the NCRI for setting up this event. This event, the Brexit deal, what it really means to cancer research and innovation. My name is Pam Kearns. I'm Director of the Cancer Research UK Clinical Trials Unit at the University of Birmingham and Director of the Institute of Cancer and Genomic Sciences. I'm also President of the European Society of Paediatric Oncology, and I've got a huge interest in how we collaborate with Europe now that we're outside the European Union. We want this to be a really interactive session, so please post your questions in the Q&A. If I can direct you to the control bar, you'll see a Q&A sign, and you can send your questions in there. And also, if you like the questions, if your question has more likes against it, the more chance it is of being asked. So please put your questions in the Q&A bar. And for those of you that are social media savvy, the Twitter hashtag is #NCRIVirtual. Please advertise the event. So without further ado, I think we've got a really amazing panel here to discuss where we are in terms of cancer research and innovation now that we've left the European Union. And I would like them to just introduce themselves and say a little bit about why the impact of Brexit on their working lives. And so if I could come first to Sheuli Porkess from the ABPI. Sheuli.
Hi, and good afternoon, everyone, and thank you for the invitation to be part of this panel. My name's Sheuli Porkess. I'm a medic who's been in the industry for a number of years and the interim medical director at ABPI, which is the trade association for the research-based pharmaceutical industry in the UK. I've been involved in ABPI policy work on Brexit since the referendum, and I think Brexit really made us focus even more on the need to be internationally competitive for commercial clinical trials. COVID then highlighted this even further, and as we've navigated the past year, collaboration across the sector has been key. And as we stand today, the UK has left the EU, but also the pandemic has brought lots of disruption to global R&D and healthcare systems. And the UK is on a new path, and the world's watching to see what happens next. And I think, we need to reflect on lessons learned from COVID, but we need to embed these new ways of working and lock in transformational changes that can enable future clinical trials to be conducted across all disease areas, not just COVID. And I think today there's a couple of things to reflect on. So the Brexit's impact on the UK clinical research environment, but also the vision for UK clinical research and how to realise that. There are a number of sort of key aspects for the deal for commercial clinical research. So it's participation in EU programmes, data adequacy, clinical trial supplies, regulation of trials and immigration. And there's been lots of work to date and ongoing work to understand the details and how to work through it in practice. But I'm also mindful the rest of the world is changing, innovating, recovering from COVID. So it's not just what we do now, it's, the actions that we take to really make sure we've got a solid approach to clinical research. And I'm pleased we now have a Department of Health and Social Care Recovery, Resilience and Growth programme, and it'd be great to talk about that later. And yeah, it's tough at the moment with the effects of COVID, and we also know some of the practicalities of Brexit haven't been worked through, but I think we've got the Recovery, Resilience and Growth programme in place that gives us opportunities we haven't had before to get through those changes, to ensure recovery from the pandemic and to drive that growth in research that we all want to see.
Thank you, Sheuli. There's a huge amount to unpack there, and hopefully we'll come back to a lot of that in a lot of detail as we go through the webinar. Can I ask Emlyn Samuel from Cancer Research UK if you could just introduce yourself?
Yes, thanks so much for having me along. I'm Emlyn. Yes, I'm the Director of Policy at Cancer Research UK. Like Sheuli, ever since the referendum, Cancer Research UK has been working on Brexit and the implications of that. We've been working with the UK government and across Europe to ensure that whatever the outcome, that patients, cancer patients and the research environment have been protected as far as possible. There are a number of areas that we've been working on in particular, particularly focused around the regulatory environment for clinical trials, really important for Cancer Research UK. We're a big funder of clinical trials, and nearly a third of those trials involve patients from other EU member states. So that pan-EU trial focus is really important agenda for us. We've been also working to ensure that patients could continue to access new and innovative medicines, as well as supply of existing medicines across borders. And then we've also been monitoring and working on the broader research environment, our Horizon Europe Association, which I think is one of the real positives that have come out of the deal, and also the implications of the UK setting up its own immigration system. And overall, I mean, I think there's probably a huge amount of relief that there was a deal at the very last minute. It provides a platform for further development and negotiation in terms of the UK's relationship with the EU. Doesn't do everything that we would like it to do, so I think it's a platform for further development, and I'm sure we'll get into the details of what it means for cancer researchers and cancer patients in due course, and look forward to the discussion.
Thank you, Emlyn. If I can now turn to Professor Richard Sullivan from King's College. Richard, you have so many different roles, so tell us a bit about your roles and your perspective.
Thank you so much, Pam. Lovely to be here. Hello, everybody. Welcome. So, as Pam said, I'm Richard Sullivan from King's College London. I was formerly worked for Cancer Research UK as well, a long time ago in a different life. But in this guise, I guess I'm here as the director of the Institute of Cancer Policy. And broadly speaking, over the last sort of 2 or 3 years, we've been working on research, looking at the impact of Brexit on cancer research, both for European partners such as the European Academy of Cancer Sciences, but also our domestic collaborators as well, in 3 areas. One on the socio-economic impact of what Brexit means for cancer research in the UK and more broadly across the European Union. The second area, more about the sort of mechanistic aspects of collaboration and partnership, and particularly, as Emlyn alluded to, the policy changes around migration, emigration, and the ability for people to freely move across borders. And thirdly, a slightly unusual left field area is, as I guess we call it, the political science of Brexit for research. And here we're really talking about really the sort of political attitudes to collaborations, and particularly in major domains. The UK has enjoyed enormous amounts of funding, which I'm sure we'll talk about later, from previous European Union funding schemes. There have been major leaders in some really big consortiums, and the question really is, has the cultural changes of Brexit meant that actually now we will be pushed not so much into the right at the back, but certainly into the middle of the pack, and no longer be given front and centre stage in terms of leadership for some of the big initiatives that will undoubtedly happen over the next Horizon Europe. But I'll talk a little bit more about that as we go into the discussion. So great to be here. Back to you, Pam.
Thank you, Richard. I begin to feel that an hour is not going to be long enough to cover all these issues, but I'm really delighted now to move on to Jim Elliott, who's in the NCRI Consumer Forum. Jim, tell us about yourselves and your perspective.
Thanks, Pam, and it's great to be here. Hello, everybody. So, yes, I'm Jim Elliott. I'm a member of the National Cancer Research Institute Consumer Forum and also Independent Cancer Patients' Voice. And I'm there as a carer of many close family members with cancer over many years. And in thinking about Brexit, I've sort of got a few general points and then some more specific observations, because I was conscious in coming into this that my own personal view is one of being quite strongly opposed to Brexit, and therefore I consulted, as a good consumer does, with fellow members. So that there are about 100 of us in total, and I'm very grateful to 24 of them who responded to me. So I've got a nice range of thoughts and views, and it's very clear from my own view and those that I consulted that Brexit per se doesn't offer any sort of immediate obvious benefits for cancer research, but and it wasn't done to fix any problems that there were there. And it's also very hard for us to kind of unpick what the issues are at the moment because of the pandemic, which is very much at the forefront of many cancer patients and their families in terms of the impact it's having on cancer care and research and the impact on charitable funding. And also the length of time that it was from the vote to now meant that it's very hard for the general public to try to pick on what's in, what's not in. So it's really quite a confusing time for us. Despite a kind of unanimous view amongst us all that we don't really see any benefits from Brexit, actually there is an element of kind of optimism in a sense, in that and which is very characteristic of the cancer patient advocacy movement, where we kind of a can-do attitude, I suppose, to sorting things out. So reasonably confident that the UK community in research, and I say that rather than British because it's quite a multinational community, will find ways of carrying on and doing what we do in collaborating across Europe very well as we do in the rest of the world. And then there were sort of three particular themes that came out of the contributions I had. One was around some specific worries and concerns. The second was actually there are arrangements which actually are unaffected by Brexit, which are helpful. And then a few things that we probably should do to help ensure that collaboration continues. I mean, of the specific worries and concerns, the one that floated to the top was free movement within the EU, which is seen as very much a significant enabler of collaboration in all walks of life, but particularly for Cancer Research UK. And we all had examples where it's been a great enabler. So concerns about that going, and also the reciprocal difficulties maybe for EU nationals coming in. Some specific concerns around some types of clinical trials, so paediatric oncology and less common and rarer cancers, where in order to run trials with enough power, we have to do them in multiple countries. So starting UK trials or continuing UK trials, we need to be able to recruit in Europe. So some worries about whether that will be able to happen. And also some concerns about the possibility that UK patients may not be eligible to take part in trials being run in the EU. There's also a couple of concerns about sort of specific instances where people have seen relationships maybe breaking down a bit, or funding maybe not going forward late in the day before the deal was done. And then finally, the Northern Ireland Protocol is quite uncertain for people in Northern Ireland. Will they be able to go across to mainland Britain for treatment or take part in clinical trials? Then there's a number of arrangements we're aware of that carry on regardless. So actually there's lots of existing collaborations across Europe, many of them long running. And the feeling we get as a community is that they will continue based on past success and goodwill. And then some of the organisations like European Organisation for Research and Treatment of Cancer, EORTC, which is actually predates the EU and isn't dependent on Brexit or EU funding directly, although it has some, I believe. And then the patient organisations like the European Patients Organisation, European Patients Academy, which again operate kind of independent of Brexit, which is good. And something I'd never thought of, but somebody mentioned, is of course the language of cancer is English, so that kind of enables us in a sense to carry on. And then building on that, some of the enablers, some of the things we need to carry on doing is, the pandemic's been confusing, but actually our move to doing things like this virtually has actually been a good enabler to collaboration across borders. And there are some things we think within the withdrawal agreement and the trade deal around such as joint declaration on participation in union programs, which hopefully should be enablers. And just generally, building on goodwill and a sense really that it's our responsibility. We're here where we are, whether we liked it or not, and whether we want it to happen or not, and it's our kind of responsibility to make it happen. So I'm sure a lot of those things will come up in questions as we move forward. So it'd be good to get the first question and move on. Thank you.
Thank you, Jim, and I like your comment. We are where we are. That's exactly right, isn't it? We can't keep going over the history of how we got here. We've got to work out where to go forward now. So just a reminder to all the participants, please put your questions in the Q&A. While you're thinking of your questions, I'll warm up the panel with a few starter questions, and I'm going to come immediately to Emlyn in the first instance. We're about 6 weeks in to being outside of the EU. What's the lived experience from cancer researchers at the moment? What are you hearing on the ground about the impact?
Thanks, Pam. So we've been going out and seeking insight about the kind of the short-term impact, and I think it's fair to say that at the moment we're seeing quite minimal impact from our exit to the EU. I think we can put that down to a huge amount of preparation that went in to from sponsors, from universities, from industry, from government to prepare for a no deal exit. And actually that has put I guess us in good stead in many ways. So sponsors have gone through lots of process to amend contracts to ensure data flows can continue, and the deal does actually give us a short-term reprieve while we hope a data adequacy agreement can be agreed in the long term. Sponsors in the UK also have had to set up legal representatives in order to ensure that pan-EU trials can continue functioning, so setting up legal reps in the EU, and all of that sort of stuff has been done at great, effort and cost as well, I should say, to ensure that we were prepared for what was coming, and therefore we're not seeing a huge amount of impact at the moment. I think what is to come is still uncertain. There are still a number of questions that need to be answered as we develop our new relationship with the EU. And just touching on immigration has been talked about a number of times, and it's a huge importance to the research community, because a mix of domestic and international talent is what makes the UK unique and world leading in terms of cancer research, and particularly for the people that we fund. Obviously the new immigration system for the UK is in place, but we are not seeing big flows of people at the moment due to the pandemic, and so we're really yet to see that tested in real life. So there are still quite a few big unanswered questions in terms of how things will work in the long term, particularly in terms of that immigration, but also our regulatory status and how we will continue to partner with the EU on clinical trials and research going forward.
So lots of preparation, but we're in a holding position at the moment while we wait for the next stage. Maybe I can come to Richard next. Just picking up on this, you talked in your introduction about having looked at the practicalities, the policy around this, and the actual delivery in Europe. I mean, what is your feeling on how we're going to end up in terms of European collaborations? What's that going to look like?
Well, as Emlyn said, I don't think we'll see an immediate impact. I think, unfortunately, the pandemic is going to be writ large over movement and engagement over the next year. Certainly within the trade and cooperation agreement that was concluded on the 24th of December, we obviously now are going to become an associated country like Switzerland, Norway and in Israel, and we will bid and receive money pretty much like other European member states for the foreseeable future for this New Horizon Europe programme, which is going to be huge. It's estimating, I think, about 95 billion over 7 years. Now, of course, that gives us access to the European Research Council, Marie Curie, collaborative projects, and also allows teams in the UK to lead those. So in that sense, from a supranational level, we'll see very little difference and change in that. Of course, what has gone is the Erasmus programme. I think the jury's out about how big an issue that's going to be, and that's been replaced by this global talent visa. And again, when you look at the global talent visa and the need for it to be endorsed by a sponsoring body, probably UKRI, I think the fee's about £600. The feeling you get is increased friction. It is certainly going to be not as easy as it was in the past to bring people to work in the UK. I mean, technicians will come under this new skilled worker visa, which will replace Tier 2. Again, we're really not quite sure how this is going to work. The general feeling is increased friction. But I guess for me, the problem is at the moment is we simply don't know what's going to happen in the rest of Europe, because at the end of the day, this is a marketplace. If the funding for cancer research stays very good in the UK, in other words, federal and philanthropic funding remains high, there will be lots of jobs and lots of posts. In other parts of Europe, the likelihood is the economic downturn will have impacts in the provision of those jobs. So people will still be looking to move across borders. But I think the problem again is we simply don't know how this is going to culturally play out in terms of scientific diplomacy. I mean, how many British experts now will sit on EU committees? And again, will we be sort of taking a back seat rather than a front seat? So I think generally at the moment the jury's out. The friction is going to be worse, I think, in the immediate term until things are sorted out around the visa problem. But again, there are lots of other confounding variables here that could really alter the flow of people either coming from Europe to work in the UK, or indeed the ability of UK citizens to work in laboratories in other countries in the European Union as well. Because I think, you know, the beauty of the pre-Brexit environment was it was a free two-way flow. People went and worked in laboratories in Germany and Poland and France, and individuals came to this country, and it was that sort of flow, that cultural build-up, that really provided the strength and depth for the UK, and I think, you know, helped all ships float up. And how we retain this, and I think Sheuli mentioned this, is going to be much more complicated in the post-pandemic environment, simply because of the depression and the economies as well. So I'll stop there, Pam, and hand back to you.
No, thank you, Richard. And I'm going to come to Sheuli next. Sheuli, I know you've had a few technical problems, so but I just want to bring you in specifically to ask about the impact from the pharmaceutical industry point of view on clinical trials. You know, we've been waiting to see what the deal looked like, and then how that would translate into how the pharmaceutical industry viewed the UK as a place to do research. Now that we're here, how does it look?
Yeah, so thank you, and yeah, apologies for the technical issues. I think, you know, we did do a lot of preparation, and during that time, you know, there was concern that if we didn't have a deal, there would be an issue with moving products for research. So either the medicines themselves, the placebos, the clinical trial supplies, you know, equipment, samples, and how that would play out in practice. But the trade agreement does include tariff-free trading goods, which means that actually import of that equipment and the consumables should face only a few additional hurdles. However, we do know that there are levels of concern and confusion from sites and sponsors around, for example, the customs processes for clinical trial supplies and samples, and EORI numbers and tax implications. And we're working at the moment with Department of Health and members of the Life Sciences Clinical Research Working Group, including HRA and MHRA, on addressing the questions that are coming up, and also including any implications of the Northern Ireland Protocol. So, DHSC and HMRC have been working closely with our members to address those outstanding questions and queries. I think so the questions are coming up, but they're being dealt with as they come up. I think the detail of Horizon Europe has already been mentioned. Another area I'd probably talk about, which isn't maybe immediate but not that far off, is the question of data adequacy. The UK is going to stay governed, or is governed, by the EU's data transfers framework for a 6-month period, so until July 2021, while the EU makes a decision on whether there's data adequacy or equivalence. And so we're continuing to work with members and government on addressing that and others, and really sort of would urge both sides to agree a positive decision on data adequacy, because that 6 months, I think, will be on us very quickly. And beyond that, I think the other piece that's come up is, which again is a bit further out, is immigration, and as Richard said, looking to see how that plays out is really important.
Thanks, Sheuli. And just coming back to Jim, you made a really important point about the breakdown in terms of European collaboration. So most patient advocacy groups are, as you say, European, not EU. How do you think the patient advocacy groups are going to help unite us we've talked, I think Richard talked about that friction that might already be starting to happen, but from a patient perspective, you really want us to continue to collaborate. That was clear. What are your thoughts on how we can continue to do that?
Thanks. That's a good point. I think as Emlyn said to start with, we're not noticing anything specific to do with Brexit so far, and we're mostly concerned with the pandemic as a kind of wider community, which means we've been working as we've been working before. So I think it's, the relationships are there, the goodwill is there. There are UK patient advocates who are members of European groups and vice versa. I think it's really, we see nothing at the moment to stop us carrying on doing what we're doing. I think if anything, some of the challenges that may lie ahead make patient advocacy our role in helping to ground and support the importance and relevance and acceptability of clinical research becomes more important as we move forward. And the fact that we already have really good working relationships with many other European patient organisations and individual patient advocates is a good thing. I think the information on some of the supranational funding is very encouraging from our perspective of wanting to see research continue. But from now, I don't think we need to do anything different. We just need to keep doing what we're doing. And so far, nothing is getting in our way, but we're not actually able to travel anywhere yet. And we don't know the impact of things like not having an EHIC card in case we're ill and that kind of stuff, and how that will play out. But for now, we carry on almost as if it hadn't happened, because nothing's telling us not to, if you like.
I mean, that you're highlighting some of the huge uncertainties, but I think the patient advocacy groups are going to be key to, as I say, gluing us together in the future. I'm going to go to the audience questions because there's quite a few accumulating now, and the one that's been liked most is an important question, which I'm going to take to Sheuli, which is about the EMA. Does sitting outside the EMA with the potential for so-called speedier approval from the MHRA for innovation make the UK a more attractive bed, a test bed for treatment innovation? So are we going to be leaders if we're outside the EMA with the MHRA in the driving seat, I think is the question.
Great, yeah, very happy to take the question. I think where we're up to, for global sponsors conducting multinational clinical trials, regulatory cooperation is key. So we welcome the commitment in the trade deal to identify and promote cooperation activities. And I think if we think about clinical trials, we're starting from a position of alignment as the EU directive was transposed into UK law, and the EU clinical trial regulation isn't yet in force. And we've got the UK Medicines and Medical Devices Bill to review and reform clinical trial regulations and work out which parts of the EU CTR are adopted or not. And we very much think that industry consultation would be needed here. And I think the UK needs to collaborate and provide leadership on that global stage in developing those global regulatory standards, whether it's in trials or manufacturing or licensing. The UK needs to minimise duplication of regulatory effort for companies because they work in a global environment. But initiatives such as the newly launched innovative licensing pathways, the ILAP, will be key to boosting UK competitiveness, but because they're entirely operable within the parameters of globally recognised regulatory standards. And the ABPI is already working with MHRA and government on enhancing UK environment for innovative trial design. So I think it's this boosting UK competitiveness, but within the parameters of globally recognised standards that companies can engage with and as part of their global development process.
Okay, Emlyn, do you want to comment on that?
Yeah, I think this is one of the really big questions to come, is the development of the UK's regulatory framework and how that, from our perspective, strikes a balance between really promoting domestic innovation in areas that we know that we could be stronger, like early phase trials or complex innovative design trials. So how can we really maximise the UK environment? At the same time, Cancer Research UK, we've made no bones about it. We think the clinical trial regulation that we played a big part in shaping is a good piece of legislation, and we ideally wanted to be part of that piece of legislation. We're not going to be. So how does this future regulatory process and framework balance the needs of domestic innovation with our ability to collaborate internationally? And that is the key question that will need to be answered. I think the MHRA, from what I've seen so far, is taking quite a pragmatic approach to this from what I've seen. So I do think I am optimistic that we'll hopefully strike the right balance. But I do think this is there's going to be a lot of work to come on this. We are preparing to input into consultations and government proposals around this in the months to come, I do think this is really going to be the key question that needs answering in terms of the UK's global status as a leader in clinical research.
If I maybe come back to, and I don't mind either of you to respond to this, are we at risk of isolationism? Will people want to come just to UK to get marketing authorization for a drug when they can go to a large landmass like Europe or the US? Do you think we'll end up on the outside, I guess? Sheuli, what do you think?
Well, I think this is one of the things that we're all working hard to look at, and it's looking at everything from early research through development, clinical research, the environment for licensing, for reimbursement and uptake, and looking at that across the pathway and saying how does it all fit together, and how do companies engage with that? And we're doing a lot of work, and have been doing a lot of work over the last few years on this, to say actually this is what's important to companies when they're making their decisions about where to place research and into invest in manufacturing or whatever it is, and how can we build those in as we think of the environment for that companies engage with.
Okay, thank you. I'm going to just slightly shift tack because the question's moved on to funding. Emlyn, I'll come back to you on this. Will Brexit affect funding streams that enable cross-border research? For example, the CRUK's Accelerator Award, which had the co-funding with Italy and Spain. Do you think that funders need to put additional schemes in place to allow cross-border research to happen?
Oh, that's a good question. I mean, I think there are lots of different parts to this, and I can't necessarily speak for what funding schemes should or should not be put in place. I mean, clearly a positive out of the deal is our participation in Horizon Europe. There's a big question at the moment about where the money for that comes from, and a concern that it could come from the UK's R&D budget, which has only just crept up through the last spending review. And I think it's, us along with I think the rest of the science community would like to see new money associated with that, so we can really reach ambitions to be spending much more on R&D in the UK. So that's one thing. The other context to put in play here is something that Richard mentioned earlier, which is how much funding is going into oncology in the UK. And unfortunately, as we know, COVID has had an impact on charitable income for Cancer Research UK, but for other medical research organisations as well. And this is very real, and we're unfortunately having to make cuts at the moment due to this. We are speaking with government about how they could help us protect some of the vital investments that we have in oncology. But as a funder of half of all publicly funded cancer research, there is a worry about the levels of investment going forward. And I think it's absolutely vital that we make this case to government about how oncology is part of the future of the UK's ambitions and the government's ambitions to be a world-leading science superpower, as they put it, which I think is absolutely possible. But there are challenges along the way. As part of the Horizon Europe programme, for the first time, there is a cancer mission. We haven't seen this before, and I think, again, there are positives there. So there are quite a lot of different things at play at the moment. I can say that Cancer Research UK is continually committed to funding the best research, and that includes research that is international in its nature. It's really important. So I hope you could be reassured by that. I was really pleased to see just a couple of weeks ago, we published or press released a study called the Marietta study, which looked at development. It proved that the new treatments in a rare form of lymphoma could really benefit patients, and that worked with UK and Italy and recruited patients across 4 different countries across Europe. That is the type of research that we still want to be doing, really driving progress for patients, and whether that's within the UK or partnering with others internationally, that is what we're here to do.
Thank you, Emlyn. It's reassuring. As you say, it's not just Cancer Research UK, but lots of funders that have got to start thinking along similar lines. I'm going to just bring Jim in on this, because I think you raised the perspective of both childhood cancers and rare diseases, and the difficulty if we have less cross-border research. Do you want to make a comment on this?
Yes, thank you. I mean, I think both the point about regulation, but also the one about funding, really play to this concern. It's vitally important that studies which need to recruit across borders are unable to do that, and so there's a significant concern in the patient advocacy community about that. But it's actually reassuring to hear, particularly what you were saying, Emlyn, about the amount, and Sheuli as well, about the amount of preparation that's being done. And it's really important to keep this sort of high up the agenda. And I think one thing from the regulatory side is it's encouraging to see the MHRA starting to work with patients much more directly in its licensing decisions, as opposed to simply, what it's done in the past, which is more around sort of phase 4 monitoring and things like that. And the EMA has been working with European Patients Association. So I think if the MHRA can mirror more what's done by the EMA, then that will help to reassure patient groups that all studies will be supported, and there is a way to get multinational recruitment or maintain multinational recruitment.
Thanks, Jim. And that maybe is an opportunity that if the MHRA are taking the lead for the UK, that can have more direct contact with those discussions. I'm going to take a question to Richard now. An interesting question that's been raised, I guess a political question really, as to whether the increasing fragmentation within the UK is likely to be more problematic in the long term. So how long before the MHRA, HRA are all English only, so that we end up with different marketing licenses and different early access schemes across the UK? It's a challenging question.
I mean, yes, you could be cynical and look 10 years ahead and say, one day we'll have an independent Scotland and a reunited Ireland, and then everything will look completely different. I guess for now we treat this as Emlyn said before, and Sheuli, which is this is the UK as a whole, and in terms of devolved collaboration on this, it's absolutely essential. I mean, in a sense, we've been talking about parochialism being really bad for cancer research and patients. It's even truer when it comes to the UK. So there just cannot be any borders whatsoever. And I guess it also comes out to this point you alluded to about the research diplomacy as well, more broadly. So there's lots of mechanisms at the moment being worked on. And there is going to be access to funding. How much funding comes into the UK from the European Union, I think we wait to see. I mean, it was remarkable. I think the UK research community enjoyed about 1.5 billion euros of inward investment under the last framework programme. So, can that level continue to be attained? And you're bearing in mind now, nearly 80% of the funded programmes at the European Union level had UK researchers involved as well. So this was a really important ecosystem. It's obviously as cancers become rarer, the importance of cross-border work for childhood cancers. I mean, that is simply going to be the future, really. Can that be maintained? And I think it only can be maintained, really, if there is a real effort around this research diplomacy. There is a phrase called sort of global health diplomacy, which we talk about health as a diplomatic tool, but actually we don't talk very much about research diplomacy. We take it as read that we're always going to be invited to the party. Well, that's not going to be the case anymore. Emlyn's already talked about the cancer mission. Actually, the input to the cancer mission at the moment and what's going on politically in Europe from UK investigators, I would say, is relatively modest and declining. It's difficult to tell why that is. That may be just a cultural shift or a side effect of COVID. But I think come next year, the middle of this year, towards next year, we've really got to up our game, actually, in spite of Brexit, and actually really start engaging on the political front. Because I genuinely feel this is going to be the only way that we're going to keep the collaborations going and also deal with problems that will inevitably come along. Because there'll be things which will be unforeseen, which we'll have to deal with over the next 5 years. And the only way to do this is because you've kept the relationships going, which are incidental to Brexit.
Really, really good comment, Richard. And I think Sheuli wants to come in on that as well.
Yeah, and I think the from an industry perspective, we've always talked about the need for processes and systems to be harmonised as possible across the UK. If you're a global company looking to engage in the UK and put some research here, so put some clinical trials here, it shouldn't be made difficult, and you shouldn't need to know whether a certain hospital is, which of the 4 nations a certain hospital is in, and have to navigate 4 sets of paperwork. And alongside that, last year, in the autumn last year, on the back of the restart work with the pandemic, the ABPI published a clinical trials report, and we highlighted a need for a strategic approach to restarting and restoring clinical research across the UK and across all disease areas, transforming the UK clinical research environment, ensuring all patients have the opportunity to be involved and engage with research, and making research central to the UK's trade strategy. And I'm really pleased that we have now this government recovery, resilience and growth programme strategy, which is exactly that strategy we were asking for. So what do you need to do cross-sector and across the UK? So with the devolved nations absolutely part of that programme, and there are 4 areas within that. So one's embedding research in healthcare, another is using data and digital systems to underpin and speed up research, third one is building resilience into research, and the 4th is communications. And I think that UK-wide approach is absolutely critical to bringing the research into the UK. Yeah.
Thank you, Sheuli. And I'm just going to come to Jim, because that UK-wide unity, if you like, to be able to allow that to happen, will require input from the patient voice. I think the recovery plan has to listen to the patient voice. Jim, how much engagement has happened with the patient advocacy groups in developing this programme? I know it's at the beginning, but is this something that you're aware of, or?
It's something that I know our community are aware of, and it's probably worth pointing out that we talk about national bodies, and the National Cancer Research Institute, where the N means UK. So not all national things are just England or Wales or Scotland, Northern Ireland separately. So the NCRI is UK wide, and there are people in the Consumer Forum from all 4 nations. And increasingly there's collaboration with Republic of Ireland as well, so there's sort of 5 nations as well involvement. So we're aware as a patient community of those initiatives. We'd like more involvement. I think we always would like more involvement, more opportunities to be at the table and to play a part in those.
I think that's crucial, isn't it? We've got a question that's actually driven from a patient perspective. It's from Nick Kalita, who's actually on an investigational drug, and it's really nice to hear that it's having a benefit to him. But the question is that should he need another trial in the future, his worry is, will the UK be selected for sites? And I think this is it is a worry as to whether for small trials will UK still be high on the list for opening clinical trials. And is there any mechanism that can be put in place to stop UK being outside that framework? And if either who would like to take that question? Sheuli, I wonder from a ABPI.
Yeah, I can start. I'm sure others might want to join in, but. I mean, I think Nick, you absolutely get to the heart of the question here. So how do we continue to bring clinical trials to the UK and make sure that UK patients have the opportunity to be involved in that research if they want to be? And I think this is, I guess, the absolute importance of the programme that I was talking about a couple of minutes ago, and why not only is the programme really, really important, but what is very positive about the programme is that you've got key organisations who can help influence it to make the UK a place where trials can come to the UK. So we've got on the programme board, we've got government, we've got from the 4 nations, we've got MHRA, we've got HRA, we've got the medical research charities, we've got industry and others all working together to say, right, what is it we need to do in order that, you know, from my perspective from industry, but in order that when companies are saying where can we put our research, where can we go, that we'll have researchers and patients who we can work with to answer a question of whether this new medicine works or not, to make sure that the UK is high up on that list. I think I don't have this specific answer on it, but there are a lot of people working very, very hard to try and avoid the situation you're talking about, and try and make sure that people still do say, yes, the UK is a good place to bring that clinical research.
And Pam, can I just chip in if that's all right?
Yes, absolutely.
Just a real politique here. You know, the UK has some of the best early phase clinical trial activity, not just in Europe, but probably in the world now. Through the, you know, the support from, you know, CR UK, through the Experimental Cancer Medicine Centre, all the way through to, you know, own account support that universities have put in. So it's an amazing infrastructure for clinical research now that we've got. So, and companies are not stupid. They go where the people are, where the expertise is, where they have the ability to do these sorts of complex trials. So I can't suddenly see that vaporizing. It's not as if there's another country sitting in the wings here, ready and willing to suddenly, you know, take on all of this, because it takes decades of continued investment to build this up. And certainly in my lifetime through CR UK until today, that's what we've seen, this building up. The question for me is the sustainment of this. And this is partly a Brexit problem, and I'm going to say it's partly an post-economic COVID problem. And Emlyn's already alluded to the problems of, you know, cuts to the funding of CR UK because there's less giving. We simply don't know what the economic situation is going to be like next over the 5 years, and hard choices have to be made. So I guess this comes back to advocating for cancer research as still a major disease domain for investing in UK life sciences, rather than maybe on picking on any particular area. Thanks, Pam.
Thanks, Richard. And Emlyn, I think you've got to come in as well.
Yeah, I mean, I'd wholeheartedly agree with that. Just picking up on specifically the element of the question, which is about, you know, pan-EU trials and whether the UK will continue to be able to participate in them as well as lead them. You know, I think essentially we are a third country, and there are additional hurdles to go through in order to partner with Europe on these types of trials now. And that's a fact that we're going to have to live with. But the fact that we want governments to ensure you minimise as much as possible the barriers that exist. So one unfortunate thing that we didn't see from the deal, as it is now, is a mutual recognition of sponsorship from the UK and the EU. Now, we'd like to see that shift in the future. We aren't going to be part of the inner workings of the clinical trials regulation, but as I mentioned before, the UK is developing its own regulatory frameworks. It has already put in place processes that look to align as closely as possible to the processes of that EU framework. And so, you know, there are things that can be done to minimise the barriers. There are inevitably going to be more hurdles to go through to do this type of research in the future, but we know it's hugely important. We know in a world where we're understanding the genomic drivers of disease even more, that we're going to have to collaborate more across borders. This is a message that we need to continue pressing and ensure that whatever the UK comes up with, it enables our ability to continue to be strong collaborators with our colleagues across Europe and beyond.
We always need to be above the bar, don't we? Better than we were before, to sustain where we are now. I'm just going to shift the questions a little bit away from the clinical trials, because we've talked a lot about trials, but there is a question about data protection. So from Roland Arnold, he's asking about evidence of changes or problems in terms of exchange of data, personal data, with the GDPR regulations. Emlyn, I don't know if you want to, if I come back to you on GDPR, I know it's a topic close to your heart.
Not that I'm aware of. So what I know, and some others might be better placed than me to comment, but what I know has been put in place by sponsors is that they've had to change contracts to ensure that the data flows can continue as we are now a third country with Europe. The short-term reprieve as part of the deal that's in place is a stopgap. So there's, I think, 4 months maximum, up to 6 months, in order to get that final agreement on data adequacy to ensure that those data flows can continue in a seamless manner. The government, in the meantime, has said that sponsors need to have those contracts in place to ensure that data flows can continue at the moment. And I think that's the advice that obviously we'd be giving as well. So hopefully, in a relatively short amount of time, there will be an agreement on data adequacy, which means that it will be much easier for data flows to flow between the UK and the EU, which hopefully will be one less barrier to go through in terms of setting up these types of trials and sharing information across borders.
Thanks, Emlyn. Is that your experience from the ABPI perspective, Sheuli?
Yeah, I think it's this, we've got this, we know where we are for the next few months, but we really want that data adequacy to be confirmed by the EU. And in the meantime, we're just making sure that companies are aware of the latest guidance on what they should be doing to keep things moving.
Thank you. There's a few questions kind of on the similar theme about talent, research talent, and I think it goes both ways. The questions are around the EU talent and the impact of UK as an attractive place as a science hub, and also, and this includes the potential for PhD students being affected if rotating around EU labs and UK labs. Richard, to give some perspectives on what you think the impact of Brexit is going to have on this.
I don't think there's going to be an immediate impact. I guess it's looking backwards, somewhere between sort of 17 and 28% of all cancer research conducted in the UK, depending on which area you look at, has EU collaborators named on it. So it's not just the PhD students, this is a huge community from the European Union that's been actively engaged with UK citizen researchers over the last 2 decades. So I think the issue I think is going to be as well what the situation looks like for PhD students in other countries and support. So I think again in the post-COVID period, we don't really have a sense at the moment about what opportunities there are going to be for PhD students in some of the countries which are going to be economically really heavily impacted. I think the prevailing relationships that are already there, that have been established between researchers, will continue. And those are really the roadways in which PhD students move anyway. So even if there are barriers or difficulties or visa issues, usually the principal investigators running these big programs find ways of getting around this with the help of the institutions they're in. So whilst the friction may go up a little bit, mechanistically, I don't see it changing much. But I come back to my point I made at the beginning. It's hard to know what the culture is going to be. And I think this comes back to this continuation of, for researchers like that, I keep saying to people, you've got to treat Brexit like Stalingrad. Don't go into it, go round it. And if we're going to continue good relationships, good cultural workings across Europe, we've got to kind of move Brexit to the side and just get on with doing what we know needs to be done as researchers and clinicians, and develop those relationships irrespective of the friction I think we're going to come across, and get a bit creative about getting around this.
Thanks, Richard. That does speak very well to a question that came from Patrick Maguire, who was asking if there was any evidence of an impact on scientists and researchers of the government/media hostile environment who might consider coming to the UK to live and work. And I think that's exactly the point that you're making. Yeah. Emlyn, I think you wanted to come in and make a comment on this.
Yeah, just to build on that, really. The development of the UK immigration system has been a priority for CRUK. Obviously, mobility, not just immigration, but mobility of researchers is so important. But in terms of attracting talent, 30 odd% of the fellows that we fund from the EEA, 42% of the postdocs. So it's really, really important that we get this right. And in terms of that short-term mobility, so if you think about that first, so the ability to collaborate with partners and move in and out of the country, the deal actually does have provisions for a 90-day visa-free visit, and that seems quite positive. And I think there are still some question marks about how that works, but that does seem positive. So to enable that short-term collaborative mobility between the UK and the EU. When it comes to the longer term, obviously, I think the UK has had a really a good run of success in terms of attracting international talents, down to our science base and the funding opportunities here. It's absolutely crucial that we're able to maintain that in this new world. One of the major worries from our perspective is the cost of the system, and this is something that we are making representations to government on consistently. We've done some analysis that shows that the UK's immigration system is about 500% more expensive than other leading other leading scientific nations. And if there was a question there about perception. I think that is a very real question that needs to be answered. The government is very pro-science. It's put in place the things to try and attract these talented people to the UK, but we have a very costly way of doing it. And we think that is also something that the government should address.
Thanks, Emlyn. So we've only got 4 minutes left. That hour's flown by. I'm going to come to each of you just to ask for your final comments on do we feel optimistic about the future? Where can we look for the opportunities now going forward? And I'm going to start with Sheuli.
So thank you. I think I'm going to come back to the Recovery, Resilience and Growth Programme, and I think this is one example where everything, pandemic, Brexit, everything has really shown the need for collaboration, and then we're seeing it in action now. And I do think that having that cross-UK, cross-sector view on clinical research is something to be optimistic about. Thank you. Richard.
Yeah, I'm optimistic as well. I think, irrespective of the barriers we've talked about, I think in our clinical and scientific communities, we've got great friends that we've worked with for years and years across Europe. That's changes nothing. I mean, I do have to do a lot more apologising when I go and talk to my European colleagues. I usually start off with an apology and then we crack on. So yes, I'm positive, because I think the people who are going to drive it, the clinicians and the scientists and the patient groups, have their heart in the right place and know exactly what to do, irrespective of the political nonsense.
Thank you. The British are good at apologising, aren't we? We excel in it well, so we'll be good at the Brexit apology. Emlyn, any comments from you? Final wrap up.
Yeah, I'd build on that and say, there's a real purpose behind moves to bolster and strengthen our life sciences environment, our clinical trial environment, our ability to do research in the NHS. These are all very positive conversations that are happening at the moment. That isn't a backdrop of how we develop a regulatory framework that enables that, but also allows us to be an international player. But I do think there are opportunities ahead in terms of the future life sciences system in the UK.
Thank you. And then finally to Jim, really important, you raised big anxieties from the patient community at the beginning. Do you feel reassured?
Thank you. Well, I mean, on a personal level, I'm reasonably reassured, but then I'm well connected with this with the system, and as are many members of the Consumer Forum. But I think from a sort of wider patient perspective, I think there is anxiety out there, and I think there's a real need for some good communications and engagement about once the pandemic has eventually blown over and people start to think about recovering and care and research. I think clear communications about what's being done for the benefit of patients and how the different organisations we've been talking about in this have been working for the benefit of patients, I think would be very, very welcome. So it's fine for those of us in the privileged position of having a good understanding of what's going on, but I think your average patient out there has really very little idea of what's happening, and I think we owe it to all patients and their families to be as reassuring as we can, and that's probably by working through sort of trusted organisations like Cancer Research UK more than it is in a sense at government level, because there can be some suspicion. And actually, the charity world is a trusted place to go. So I think there is a need that, but I'm personally reassured because I see people I'm I trust and I'm confident in doing what seem to be the right things.
Thank you, Jim. That was a really fantastic note on which to end. So I would say a big thank you to all the panel members and to all the audience for participating. Please complete the survey and also go to the NCRI website for future virtual programmes. Thank you all very much for a really engaged discussion.